To my channel A.Medical Knowledge. Here we are going to discuss the upper respiratory tract infection or diseases. Diseases of upper respiratory tract it include common cold, sinusitis, rhinitis, pharyngitis, acute laryngotrachobronchitis, influenza, and inhalation of foreign bodies. In this video, we are going to cover these all topics and also see the video of the documentation of these problems. The major passageway of upper respiratory tract, as we know, there is a nose, there is a nasal cavity, then the mouth comes, then there is a thorax, pharynx, and there is a voice box which is larynx. Or any infection that affect these structure or nearby structure is known as upper respiratory tract infections. Common cold, most commonly example of upper respiratory tract infection. The common cold is a viral infection that affect the upper respiratory tract. Occurrence, if we talk about the occurrence in adult 3 to 4 per year, the common cold occur in children 6 to 7 per year. The common cold is most frequently occurring infection disease worldwide affecting human. Over 200 different varieties of virus can cause the symptoms of cold. The most common virus is the rhinovirus. Other viruses include coronavirus, parainfluenza virus, adenovirus, enterovirus, and respiratory syncytial virus. Common cold is prevented during the fall, winter, and spring. Prevalent होता है summer, winter, and spring. It depends on region to region. The sign and symptoms may vary from person to person. The first common cold is sneezing. There is a running of nose. There is a headache. There is a sore throat. There is a nasal congestion, maybe fever or coughing. This is the most common symptoms, and we also face these symptoms in our daily life, that we are suffering from common cold. And in winter mostly it is very common in Asian countries. Now we are going to discuss how it transmitted person to person. It may be transmitted in the form of droplet or secretion from infected person, like running of nose, airborne or in close contact. If we aerosol small and droplets particle remain while touching the hand, we can transfer it in the air. It is present. Some viruses can live on a surface for 2 to 4 hours. Shed virus mostly on second day of illness from a respiratory secretion, not from saliva. Diagnosis. Clinically, we have to diagnose it, and treatment is supportive. Self-limited infection. Symptoms include fluid, rest, warm, water, salt water, gargling, decongestion, cough suppressants we can give to the patient. This is our most commonly treatment we do in our homes. Treatment are cold medications, cough syrups are available, plenty of rest, drink plenty of water, warm or fluids, or decongestion nasal sprays are also available in the markets. How can we prevent? We can wash our hand regularly, avoid contact to the face, cleanliness, stress we can relieve by using different therapies or medications, smoking, heat healthy vegetables or fruits, stay active, properly sleep. Now, the important topic comes sinusitis. Sinusitis is inflammation of air cavities. Sinuses is a hollow air-filled cavity, as we have already studied in first year that sinuses is the air-filled cavity. Frontal sinuses, which is present in the front of a forehead, as you can see. Then second, there is behind the cheek, which is maxillary sinuses. Ethmoid sinuses, as you can see in the diagram, it is between the eyes. You can see it in the between the eyes. Okay, while maxillary is around our cheekbone. And then there is the sphenoid, which is behind the ethmoid one. There is a sphenoid sinuses are present. Healthy sinuses you can see in, and there is sinusitis where there is an inflammation occur. The yellow area show the inflammation, excessive mucus secretion. Type of sinuses depend. Acute sinusitis, which occur from the acute bacterial infection, and it lasts for 3 to 5 days. while subacute sinusitis occur from last to 3 months mostly. Then chronic, it greater than 3 months, it can take years in chronic sinusitis. Mostly people are suffering from sinusitis and it triggers in winter mostly or some other season like fall or autumn season. It may be triggered, depend to person, region wise, it also depend. Recurrent sinusitis is this attack which occur every day. Then there is a non-infected sinusitis, that irritant or allergical condition that may cause. Infected may cause by the viral infection. Less frequent and bacteria growth. A sinuses infection, fungal sinuses infection is very infrequent. Then infected causes, if we talk about the viral infection, mostly cold, flu, respiratory, and bacterial infection also cause like streptococcus, pneumonitis. Fungal infection are most commonly non-infected. It may be caused from any allergic form that pollens, perfumes, or other asthma. Mostly patient of asthma may trigger nasal polyps, deviatum sputum, environment factor, air pollution, tobacco, and then there is a chemical irritant or strong odors. Sign, the patient come, as we know there is the area behind the eyes that affect. Also there is a sinuses in our cheek, behind the ethmoid, in frontal forehead side. So these parts are mostly infected or affected by this sinusitis. So patient come with the facial pain and the pressure on. There is also nasal congestion, there is a postnatal drips, there is a coughing, there is a sense of smell is may be reduced, there is a bad breath which is halitosis, toothache, tooth pain may be occur, the fever may also occur, and the fatigue, which is the most common sign occur. The patient feel fatigue. First of all, we start the examination. We will examine the vital sign. We'll examine the temperature, BP, and pulse. Both are normal. Then we go for a facial examination. After that, we go from nasal endoscopy. Your healthcare provider insert a thin flexible tube with the light and camera into your nose. As we have studied in radiology, endoscopy is the process in which we can insert the tube into our body or any part of our body for diagnosis purposes. There is a camera, there is a light, and that give a clear picture inside, and we can view the sinuses. We can also go for a CT scan, MRI for detailed imaging. CBC, ESR is most commonly inflammatory and infection diseases are diagnosed by CBC or ESR. Then management, we go for a oral topical. Decongestion sprays are available. There is allergic medication. Drinking plenty of water. We can also describe antibiotic if it is caused by the any bacterial infection. Antihistamine, it is allergical. Leucines, anti-agonistic pain relievers. We can also intranasal steroid spray for a limited time. We can allow a patient to use this. Pharyngitis, it is also the sore throat and it is an inflammation of pharynx as the name indicates. This is an inflammation of mucous membrane oropharyngitis, middle part of throat behind the mouth, and it is may caused by the any viral infection, any like commonly in the cold and flu, and its symptoms are for 7 to 10 days, and if we provide a supported care the symptoms may be resolved. There may be pharyngitis is caused by any bacterial infection, that most commonly streptococcus infection which most commonly occur. The symptoms also streptococcus infection or bacterial infection may be resolved in 3 to 5 days by giving an antibiotic treatment, but mostly we are not recommended anti-allergic during the bacterial infection. Mostly people take in Asian country, mostly people take antibiotic if they are suffering from allergic condition. So you should have to avoid, because as we know the bacteria develop a resistance against it, so it is difficult and it is also alarming situation. Allergen certain toxins. Then sign and symptoms, we can feel pain, scattery sensation of thought, pain worsen with the swallowing, difficulty in swallowing, गला पका होना उर्दू में जिस कंडीशन को कहते हैं वो, muffled voice, hoarse voice, swollen red tonsils mostly affecting its tonsils, white patches or pus, fevers, cough, running nose, sneezing, headache, fatigue, body pain, nausea, vomiting. These are the most common signs. In acute phase, acute pharyngitis, it resolves in 2 weeks, while chronic lasts more than 2 weeks. It may be caused by infection, viral infection mostly. Non-infected, it may be caused by smoking in an anti-inflammatory irritant. Symptoms are sore throat, cough, running, fever, pain, while there is a persistent but mild persistent sore throat and chronic cough and hoarseness.